and the women. If we
will be able to end this program within our time. And based on that, family planning in the development settings and in the heavy regions. Yes, sir. Respected audience, 2022 to 2025.
His presence here, and thank you all. Thank you very much.
Civil societies and other organizations, they work together. As a UN Agency for Sexual and Reproductive Health, UNFPA has been working with the government of family planning. So, different organizations and partners are working with intervention and approaches. The Deputy Director of Family Planning, along with the TRC office.
Midwives have been deployed to provide both SRH and increase uptake of family planning. We must increase demand.
As well as, including the sexual and reproductive health and family planning. Thank you. But meanwhile, we have Civil Surgeon, Bazar, Dr. Mahbubur Rahman, for the developing process of the family planning strategy for Rohingya population. Large number of population. And we sincerely hosting the large number of Rohingya population in the Bangladesh. And not from the beginning, I would like to request Ms. Christine Boloka, mic is yours.
The Civil Surgeon's Office from the Ministry of Health and Family. I would like to warmly welcome you and to convey year strategy 2022 to 2025, developed and approved, and not doing so is the disapproval of their husband or of their mother-in-law. That demand and community engagement is given such importance in this strategy with men and religious leaders and community leaders to increase access. We have seen a dramatic increase in the demand for family planning.
2025, Objective 1, community-based and family planning intervention.
2022, we've had a nearly 200% increase. But more importantly, as part of that figure, more and more women assisted tobacco services as well as family planning commodities to every woman partners in government of Bangladesh, to our colleagues from the Ministry of Health, from the Treasury.
DGFP in coordination with UNFPA. To Bhashantar also, you know that. UNFPA involved SRH partners. Presented the initial draft to SRH working group with the DGFP. In June 2021, DGFP signed and forwarded the.
And also, he has shown few pictures which actually demonstrate. You have seen the.
Dr. Ashraf Ahmed, Additional Secretary, Medical Education and Ministry of Family. Director, all other respectable guests, even partners, and also supporting our government officers and different NGOs. The workshop is very significant for us. I am delighted to have the opportunity.
This type of situation actually disturbs so many social issues and strategy for APMs to implement for next 3 years in important papers, and if we actually successfully implemented this type of strategies, then it will be a landmark steps for us. So I just wish the success of this strategy.
Displays Myanmar National. So 3 strategies at the first community level service, facility, second is facility level service, and also coordination and collaboration. And community level service important for us because in host community, we want door-to-door visit, eligible couple registration, counseling, motivation, and also methods, short-term methods supply, then long-term methods, LARC, and also permanent method referred to health facilities. This is the ideal activity in most communities. But at the beginning of the FDMN people's influx in Uki and Teknaf region, the DGFP office hardly work about this design of host community in Bangladesh in FDMN camp. But I am failed because maximum of the NGOs work in facility-based service. This is very inactive design because FDMN people is literate, religious barrier, and also when at first FDMN people come from Rakhine in Myanmar, they do not understand about family planning. Then we started, my department, DGFP Bazar started at the beginning in 2017, and we work closely, collaboration, counseling, motivation, and also method supply. Then after that, UN agencies support with us. I request this strategy, at first, I repeat, a strategy, community-based planning must be done, door-to-door visit, counseling and motivation, then eligible couple registration or client registration. In 33 camps in Bazar, Uki and Teknaf. Then facility level, facility is very important. Facility is important for us because LRC method and also injectable methods done in facility and also MCS activities. Then collaboration and coordination, very important for us. We collaboration with Islamic Foundation, coordination Islamic Foundation for Islam Eraloke Poribar Porikalpana, very important parts in Rohingya camp, and also coordination with UN partners and national NGOs partners.
It is very important issues for Bazar and also for Bangladesh. For kind information, the Rohingya impasse occurs in 2017, 25th August, and after that we have actually taken different type of measures for staying the Rohingya people in Bangladesh peacefully, and the government has taken different type of activities for the Rohingya peoples.
Actually, more people came. At first, our target was to save the life, save the humanity. Our Honorable Prime Minister visited Kutupalong area. She directed us, and whole mechanism, government bodies actually they engaged. And with the help of all UN agencies, UNHCR, IOM, WFP and others, 9 UN agencies are working in Cox's Bazar, as well as our INU and US, more than 100 partners are working with us. Actually, we are working together. But other than this activity, at first the problem is they are not vaccinated. The Rohingyas are not vaccinated. When they came here, we forgot those diseases actually. But after that, when they came, and the diseases, that's why Ministry of Health took a lot of initiative, and we gave them vaccine as well as cholera and other vaccine. And after that, when now it's 6 years running, family planning is a big issue. Rohingya family size is more than that. In the normal population growth is higher than Bangladesh. That's why it's necessary to and in terms of family planning. I would like to thank you, Department of Family Planning as well as UNFPA to organize this. I think after this strategy, for the next year, in terms of family planning, we will do better for this Rohingya community. This 34 camp, we have 2 old camp actually. In Kutupalong registered camp and Noyapata registered camp, other camps actually the Rohingyas are living. We will work together. I think so many senior officials, high officials from Dhaka, they came. They will guide us, they will give some direction. And some other UN colleagues, they came from Dhaka, they give us direction. We will note them and hopefully we will implement. And we will work here, we will put in place. Thank you.
And line directors from DGFP, other officials, dignitaries, country director IPAL Bangladesh and his team, dear colleagues, ladies and gentlemen, Assalamu alaikum. Today is a great day for me because of many reasons. One of the reasons is the strategy being launched today. The other reason is I was directly involved in the process of the approval of this strategy. I remember perhaps 2 years ago in a workshop here in Bazar under ACSP Operation Plan, Dr. Joha from RRC was presenting his achievements, and he mentioned that the approval of this strategy was one of his achievements. Then I raised my hand and said, any strategy has to be approved by the ministry and endorsed by the agencies concerned. After that, the then RRC, he convened a meeting in his office and I was invited to attend that meeting. Then the draft strategy was sent to DGFP, and after the scrutiny, DGFP has sent the strategy to the ministry for final approval. Then I convened several meetings with all stakeholders, especially RRC, Minister of Foreign Affairs, and other stakeholders. And based on the recommendation we received, we really revised a little bit of the draft strategy and finally approved by the Minister, from the Minister of Health and Family Welfare. We all know that the family planning is one of the most cost-effective interventions, and it saves mother lives. From the ministry, we want every pregnancy is wanted, every pregnancy is planned and intended, every delivery is safe. Therefore, we in the Ministry of Health and Family Welfare implemented the sector program. The vision is of that sector program is the vision of the Honorable Prime Minister, which is to convert Bangladesh a developed country by the year 2041. And the mission is of that program is to make everyone happier, healthier, and economically productive, so that Bangladesh becomes a developed country by the year 2041. And the goal of that sector program is to achieve SDG 3, which is promoting healthy lives and ensure healthy lives and promote well-being for all at all ages. So family planning can achieve SDG 3 by preventing maternal death, child death, and lowering TFR. This strategy we have seen and we have gone through it is very comprehensive and very inclusive. It has mainly 3 strategic objectives, which is community-based family planning interventions, facility-based family planning intervention, and advocacy and coordination. And it has many interventions and activities. I hope this strategy will be fully implemented by approving the action plan and the costed action plan, and together we can make the difference in regards to reducing maternal and child death and improving the health status of FBMN and the Rohingya, and the host community. I would like to thank RRC, Sexual and Reproductive Health Working Group, SRS, WG, DGFP here in Bazar, IPAS Bangladesh, for their relentless effort in regarding this, and finally UNFPA for their financial support. And what I can ensure for the ministry, we are all with you, and we hope that you all will be with us. Together we can make Bangladesh a Sonar Bangla, which was the dream of the father of the nation, Bangladesh, Sheikh Mujibur Rahman. Thank you very much, and we are looking forward to your help in the future.
Like your anti-terrorism, like drug addiction, like child marriage and other issues. And they also motivate people for religious affairs, religious rituals and other things. So we think that we can play a vital role on family planning issue and other social issues. You know that in every Friday, Juma prayer, our imams, we have more than 4 lakh imam and other religious leaders to aware common people on different social issues. We have 21 lakh students in our mosque-based program, child education program and other issues. So I think that we can play a very important role to aware common people regarding family planning issue, especially today's program that which will be conducted on forcibly displaced Rohingya nationals. So I would like to thank Department of Family Planning, also thank to Ministry of Health Affairs and other stakeholders and other donor agencies which are working on Rohingya people and other issues like your family planning and other things. So I appreciate Ministry of Health Affairs, I appreciate Department of Family Planning and other donor agencies which are working on Rohingya people and other issues. So thank you very much. Thank you for participating in this issue. Thank you.
Thank you, sir. Thank you.
It's really a true pleasure to join the government colleagues today from the Directorate and the Ministry and our colleagues from the UNFPA for the launch of the Family Planning Strategy for the Rohingya Refugee Humanitarian Response in Cox's Bazar. The Cox's Bazar Family Planning Strategy has been developed in close partnership and consultation with local and national authorities. We've all heard that this morning. And I would like to acknowledge and congratulate our partners for all of the work that has already been done and urge continued efforts in the community implementation of the strategy. It is comprehensive in scope, recognizing links with education and other social services, and is grounded in the principles of human rights, gender equality and women's empowerment. Its overall aim is to contribute to a sustainable and healthy environment for the Rohingya population, and it's a goal we all will strive to support. The strategy also directly contributes to achieving SDG 3 and 5 and universal health coverage. Access to sexual and reproductive health, including family planning, is a human right. For this right to be realized, access to it and family planning must be voluntary and grounded in human rights, gender equality and women's empowerment. Bangladesh provides an excellent example of best practices in increasing access to sexual and reproductive health, including family planning. Bangladesh clearly shows how advances in gender equality and women's empowerment education, particularly for girls, and increased access to sexual and reproductive health service contribute to declining fertility. The fertility rate in Bangladesh dropped from 6.3 children in 1975 to 2.3 in 2014 as a result of many of the measures that are in the current strategy. There's also a strong link between increased levels of education for women and girls and lower fertility rates. The higher the level of a woman's educational attainment, the fewer children she is likely to bear. And this is something that we've learned across many countries and cultures across the world. Strengthening access to primary and secondary education, as well as opportunities for tertiary education, will also reinforce family planning goals. Providing women and girls with more information enables them to make life-saving decisions. There is a strong evidence that family planning can be utilized as a strategy for development with a focus on enhancing health and well-being, eliminating poverty, and importantly, empowering women. Comprehensive sexual and reproductive health services and information are a central part of the package of social services provided to the refugees. Accessible and culturally accepted methods of family planning coupled with community outreach to enhance awareness around sexual and reproductive health have contributed to an increase in uptake of contraception and other similar services. Numerical targets and coercive methods have been proven to be ineffective when it comes to sexual and reproductive health. What international best practice shows over the past decades is that ensuring that women and men have access to information and the means to determine the number and spacing of children coupled with access to education and employment opportunities is the most effective way to reduce fertility. This strategy is therefore careful to emphasize demand creation, working with men and women to create awareness of and acceptance of family planning. Thank you all again for joining today and for the joint work, and as we've heard from all of our colleagues across the ministries, their dedication in making this a reality. And also thank you to all of the colleagues in UNFPA who put so much work and effort into this.
Of the nation, Bangladesh Sheikh Mujibur Rahman, and all the martyrs of our liberation war, the family members of Bangladesh Sheikh Mujibur Rahman who were brutally assassinated on August 1975. This is the month of February, and I solemnly remember all who laid their lives for our dear language, Bangla. And we will soon celebrate the International Mother Language Day on 21st February. Under the charismatic and visionary leadership of our Honorable PM, Prime Minister Sheikh Hasina, Bangladesh is steadily advancing towards the status of a middle-income country. We are also an example of excellent and exemplary COVID-19 management with very minimal casualty. Our health and family welfare sector has many other very good success stories. Our Prime Minister has shown utmost sympathy and support to the forcibly displaced Myanmar population. Despite our geographical area and limited resources, we have courageously taken up the issue for their care and decent livelihood. From the very beginning, the international development partners have extended their all-out support, resources, and cooperation to the government of Bangladesh. We are so grateful to you all. The FGMN women and girls have been facing deprivation and challenges from long back in history. They are patriarchal and mostly devout Muslims. As such, family planning issues needed to be addressed with sensitivity and caution, and we have done that. They have high rate of fertility and child marriage is prevalent, so a proper strategy for family planning was required. This strategy needed much scrutiny, stakeholder consultation, and careful planning. The Medical Education and Family Welfare Division of Ministry of Health and Family Welfare has endorsed the family planning strategy for the FDMNs, and for which our Joint Secretary Mr. Salam has worked relentlessly with his team and the Family Planning Directorate, the relevant persons. And also we have got tremendous support from the development partners, especially UNFPA and others. The Directorate of Family Planning has successfully designed the FP strategy for FDMNs. The strategy has three objectives: community-based, facility-based, and advocacy and coordination, which is very important. A detailed work plan or action plan was also formulated, and I took part in a 2-day workshop, and I was here present with the whole team for 2 whole days. And maybe you all, some of you know that I'm a medical doctor with reproductive health background, so I am personally very much dedicated to this field, and I always want to work in places where family planning, reproductive health for women and girls are involved. Now we have implementing the strategy at the field level is a challenge. So I want all of you, especially the SRH stakeholder working group here, the DD Family Planning and his team, and all others, especially the Islamic Foundation Deputy Director, I met her in the last workshop. She's very dedicated. So I want all of you to work together, and we will be supporting you. Since we have accepted the fact that the FDMN population will remain here till effective repatriation measures are taken, we have to ensure that their reproductive health needs are met and they are able to lead life in a satisfactory manner. I again thank all who were involved in this gigantic task and wish successful implementation of the family planning strategy. Jai Bangla. Thank you.
The family planning services are considered one of the essential services that must be made available in the forcefully displaced Myanmar nationals, camps and surrounding host communities in Cox's Bazar and Bhashansar of Noakhali. To ensure quality family planning services, we have working since 2017. We feel that we made a good strategy and a well-thought plan to ensure high coverage of family planning services in this area. Now we have the family planning strategy for this humanitarian setting approved by the Health and Family Welfare Ministry for the period 2022 to 2025, and thankful to Deputy Director Family Planning Cox's Bazar, Civil Surgeon Cox's Bazar, my colleagues from DGFP, especially our DG sir, who are not present for her emergency work. I am thankful to DG sir, officials from Ministry of Health and Family Welfare Division, particularly Salam sir and Ashrafi madam, RRC officials, UNFPA and other organizations who are involved in this process. The goal of the strategy is to guide humanitarian actors in providing family planning intervention to support the government of Bangladesh efforts in meeting the contraceptive needs of FDMN and surrounding host communities. We are happy that the strategy includes community-based family planning intervention, facility-based family planning intervention, and advocacy and coordination for family planning program. The initiatives for developing costed action plan is in the final stage. We all are involved in that process also. I hope the strategy along with the costed action plan will be able to improve the overall SRA's situation in the humanitarian response in Cox's Bazar and Bhashanchar. We are committed to ensure contraceptive methods as per the choice of FDMN, women and adolescents. Thank you again for your presence, appreciation and hard work. Thank you so much. Jai Bangla.
ठीक है तो भाई